Hello, everybody. This is Dr. Kevin Connors. Welcome to another episode of Connors Clinic Live. Today's episode is going to be a good friend of mine, Dr. Brady Wirick. Dr. Brady practices out in Idaho. I've known him for many, many years. In his practice, really concentrates on stem cells and using stem cells to heal all sorts of things, knee injuries, shoulder injuries, hip injuries. I know you're going to love this video. He gives some real practical advice on what to do and helping with the aging process that we all go through. As always, don't forget to hit the like button on the video. And if you're on YouTube, make sure you subscribe and hit that little alarm notification so that you don't miss any new episodes. Now, join me with Dr. Brady Wirick. Okay, welcome everybody. My guest today is Dr. Brady Wirick, and he practices in Idaho Falls, way out on the west coast for me in Minnesota. So we're going to jump right into it. Brady, you graduated as a chiropractor. When was that?
Oh, geez. 2006, I graduated from Texas Chiropractic College.
Okay. And then what brought you out to Idaho?
Fishing.
Fishing. Well, that's
Fishing
great. You want to? Yeah, I remember when I was in school, it was always practice where you want to live.
Right. So I grew up about 3 hours south of where I am now. I'm in Idaho Falls, Idaho. I grew up in a small town just outside of Salt Lake City. Well, it's not so small anymore. But when I went to chiropractic, or when I was doing my undergrad, I was actually a fly fishing guide.
Wow.
And I would take people down the river, the Green River there in the Flaming Gorge in the Wyoming, Colorado, Utah border. There's a beautiful river there, and I would take them down the river. We would fish, blah, blah, blah. When I went to chiropractic school, my boat was about the only thing I didn't sell. And so when
it came your priorities straight, at least. Right?
When it came time to figure out where I wanted to practice, the logic was, I can go back to Ogden and I can have, all these family and friends ready to see me, but it's going to take me about 4 hours to get my boat in the water.
Sure.
Or I can go to Idaho Falls, establish my own practice, establish my own people, and be 20 to 30 minutes from having my boat in the water. And here we are 13 years later. You can see which decision won.
Oh, that's great. That's great. Well, you started off practicing as a chiropractor, but you very quickly got into functional medicine, functional neurology, which is a whole field in itself. Tell us a little bit about that.
Sure. So I really never actually practiced as just a chiropractor. It was never, and I mean absolutely no insult when I say it this way, but I was never one of those find a bump, smash it down guys.
Uh-huh.
And I do clearly acknowledge that the chiropractic profession has done a tremendous amount for healthcare for individuals. But that was never really my gig. My first semester at chiropractic school, they had a party for all the new students where they were introducing all of the clubs. And I found this neurology club. And the things that they were talking about, that this neurology club explaining how the nerves worked and how the nerves controlled the body, and how you could have an effect on a nerve by firing a nerve. It all just resonated with me. It sounded awesome. And so I started studying neurology as a chiropractic student. So when I graduated from chiropractic college, I had been through enough extra coursework that I could sit and take the neurology diplomate exam. So,
well, for our listeners who don't understand what that is, functional neurology was really put on the map by Dr. Carrick. There's medical doctors and neurologists that go through that course because it's so extensive. It is literally the elite of both medical and chiropractic professions that graduate from Carrick's diplomate program. So hats off to you there.
Thanks, man. I appreciate that.
And now you practice functional neurology for a period of time, and now you've branched off into doing some other work that's even more in depth. Is that right?
That's true. I'm going to say about 3 years ago, one of our colleagues started bothering me about, or not bothering me, pestering, I don't know how to call it.
Nudging you.
Nudging me in the direction of this whole regenerative medicine thing. And at the time, it was just stem cells. He started talking about stem cells. I'm like, what are you talking about? What in the world is a stem cell? I remember talking about them in chiropractic school, but I really just didn't have a clue. So I started looking into it a little bit deeper. And the more I dug, the more it made sense to me.
You saw the benefit of it.
I saw the benefit of it. I saw what it was doing for people. You know, throughout my career, I've helped a tremendous amount of people with some crazy, things that no one else could help with. But at the end of the day, when it came to osteoarthritic joints and, these bone-on-bone arthritis cases, they really only had one option, and that was to refer them to a replacement.
Yeah.
But what really got me excited about this is, well, you could take one of those bone-on-bone cases, give them one injection, and put off having to have surgery for possibly even ever.
Yeah.
My dad was I'm not going to call him my guinea pig, because I had to commit to this before I could actually do it. Because you have to, being a chiropractor, I can't put needles in people. I can't prescribe anything. So I had to put the pieces in place so that I could hire nurse practitioners to do that portion of it for me. So there really was no, hey, I'm going to test this, other than just going full throttle. But my dad was the very first person that we injected, and that was we're going on about 19 months ago. And at the time of his injection, both of his knees were scheduled for replacement surgery, and he's completely avoided it. He rode, just 2 weekends ago, he rode his bicycle 27 miles in Sun Valley. I mean, it's crazy.
That's amazing.
And that was just my dad. And now we're getting all these other people that are coming back saying, holy cow, I can't believe this. Like, just recently I posted about a gal that was 85 years old. And her doctor basically said, if you want out of this back pain, then you're going to have this extensive back surgery. And at 85 years old, you and I both know how well that turns out.
Right. That's just not good.
And now she's back going, I'm 50% better, and I'm able to do these particular activities. But the more you dig in this stuff, Kevin, the more it blows my mind, because now we've gone from stem cells to these things called exosomes, which are they're the chemical secretions that stem cells release to do their job and readily cross the blood-brain barrier.
Wow.
So now we're seeing people that come in that are saying the first thing that they notice is that their brain fog is starting to clear up, their energy is starting to lift. And so we're having neurological and systemic effects just through injections.
Yeah, I'm just really interested to see what kind of results you get with people with early onset dementia and what that's going to do for them, and if that could push Alzheimer's. My mother died with full-blown Alzheimer's. Right. And a big part of what pushed her into the dementia realm was her knee replacement surgery that she had. She had a lot of problems with it. She was supposed to get both knees done. She refused to get the second knee done. And that was a couple of years before her dementia really onset. So that was before stem cells existed. The knowledge of this existed. I wish we could go back in time and change things. I don't know what the outcome would be. I think it would be a lot more positive than it was.
For sure. We're still a long ways off from knowing exactly, but we're seeing very, very promising things. And I think it's important, too, that we note that there's a lot of misconceptions about stem cell therapy. There's a lot of people that still hang on to this crazy idea that we're using like embryonic cells or cells that are coming from aborted fetal tissue.
Well, that was been proven a couple of years ago.
I know. But people, I get flack for that here still.
Yeah.
It's just not happening. It's not true. These come from donated umbilical cords that are tissue that, unfortunately, in this country, 97% of the time, this tissue just gets discarded and thrown away.
Yeah.
So the entire stem cell industry is operating off of 3% of the people who will actually donate their cords.
Right. Yeah, it's everybody thinks of that if they are old enough. Think of the Bush era where the argument about using fetal tissue. Well, it's been long proven that fetal stem cells don't work the way anything else, the way stem cells you want them to work. So
Right.
Nobody's using that. So great. And you're having great success with it. You've been doing this for 3 years now, you said?
No, we've only actually been doing it for about 18 months, but it took me that long to get enough confidence and information and to get the pieces put together so we could do it.
Well, you're a wise person, not just jumping into something. So,
right.
And you had a very, very healthy, successful practice. I know that of you prior to that. You taught functional neurology to doctors. Are you still doing any teaching?
I don't do it for functional neurology. I don't do it for other doctors at this point, but we do a lot of education for our patients. We still do a lot of functional medicine stuff because, but frankly, the way I put it to people is this: if we're going to help you grow new cartilage, your body needs the building blocks to make those cartilage.
Yeah.
And that cartilage. So do you want your new meniscus to be made out of Fritos and Coke, or do you want it to be made out of real food? And so we still do quite a bit of educating as far as, hey, this is actually how you should eat, and what actually is healthy versus the standard American garbage that's out there now.
Right. So is it mainly knee stem cell work that you're doing, or can you do hips, ankles, any degenerative joint?
Any degenerative joint. Knees and shoulders are the easiest because they're these big, juicy, encapsulated joints that it's pretty easy to get into that joint capsule. We still do knees, we still do spines, we still do necks, but knees and shoulders are our number one and number two.
Okay. Wow. Well, great. And then what are some other major things that you focus on in your practice? You mentioned diet. Do you do a lot of nutritional pieces with these patients too?
Yeah, we sure do. We have, in fact, if you follow me on social media, you'll see that recently we've been doing something called Foodie Friday, which is where my wife and I actually post the recipes that we use in our day-to-day. And then we have a detox procedure that we developed with US Enzymes. We put that together. We have a webinar that's associated with that. So a diet's a big chunk of it. But here is on the daily in the office, it is mainly focused on regenerative medicine.
Well, let's plug your website here. This would be a good spot for it, and your Facebook page too.
Sure. So IamRegen.com is the website. But if you, Facebook is just Dr. Brady Wirick, and that's Wirick.
So it's all about regenerative medicine, and that's very hot topic. A lot of education on regenerative medicine in the last 10 years. It's really growing.
Absolutely.
Because the practice of medicine tends to be just trying to patch up disease and, decrease a person's symptoms around a disease process, not really changing a person's body to heal from the disease. And more people are becoming wise to that. That's why doctors like you and I are, the practices are exploding, and people are starting to take, I'm older than you, and I remember when I graduated having to educate people. The difficulty was so high because there was no internet. There was no other forms of education for people. Now people can Google this information. Websites like yours, they can get a lot of information from, take back to their doctors, or start doing some things on their own, and it can be really a blessing. Now, there's not a lot of doctors doing stem cells like you. You're kind of a unicorn out there, aren't you?
Unicorn, renegade, just depends on how you want to look at it.
Yeah.
It is a growing field, and there's stem cell therapy has been happening for since about 2006. There were groups of doctors that started using your own stem cells to do regenerative medicine, and so they would take them. They'd actually do they'd drill into your hip and take your bone marrow and culture your own stem cells from there.
Sure.
And it works. It's a great therapy, but that's first generation biologics. Now we're into second and third generation, where we now know, and we have the ability to take those the umbilical cord cells, which are younger, more potent. They divide about 4 times as fast. They're just flat out more effective. They are an off-the-shelf product. So what I mean by that is When we have an injection day, like we have an injection day coming up here in 2 days, our stem cells are right now sitting in a cryo tank. They're sitting on sitting in liquid nitrogen, ready for us to use. So there's more and more doctors that are getting on board with this and seeing some growth from stem cell therapy. There's a whole bunch of doctors that are sitting back, hanging on to those old ways of using your own stem cells and taking shots at those of us who are unicorns and pushing the envelope a little bit more.
Yeah.
So there is growth in the industry for sure. And it's just, it's only a matter of time before it's more and more mainstream. Joe Rogan, I think we all need to thank Joe Rogan. He had Mel Gibson on his podcast, and that really, he was on there talking about stem cell therapy and using umbilical cord stem cells and what he saw from that and what his dad saw from it. It's really it's becoming more and more prevalent.
Yeah, we'll have to look at that too. I bet with your kind of service, people fly in from all over because it's not something you have to do over and over and over again necessarily. It's are there second injections that you would do down the line?
We have done that in the past for people who just flat out wanted them.
Or most of the time, it's not necessary.
Most of the time, it's not necessary. We've had people fly from parts of Canada that I didn't know, or they drove from parts of Canada that I didn't even know existed. We've had people fly in here to Idaho Falls. We've had them fly their private jets in here. It's been a very interesting way of practice.
And the interesting thing is it's so much, it's not a procedure where you are laid up for a couple of days or anything like that. No. So there's so less invasiveness. There's really zero risk. And it's so much less expensive than replace. I mean, there's just no reason why you do a hip or knee or shoulder replacement before you try stem cells. It just doesn't make any sense.
If the insurance companies had any sense whatsoever, this would be a requirement before you go. You have to do this before we're going to let you have surgery.
Right, exactly.
If we're talking about just a knee joint, for example, you talk about less invasive. A knee joint's 2 needles.
Yeah.
One is an IV to take your blood, because we do use your own PRP or plasma. Yeah. So we'll take your blood, we'll spin that down, we'll combine that with the stem cells, and the second needle goes right into the knee joint, and you're driving home, and your activities of daily living aren't very restricted at all.
That is insane. It's so cool seeing, cutting edge therapies, cutting edge technique that is helping people, that isn't based upon, what the almighty insurance dollar or pharmaceutical company is prescribing for people. Right. So appreciate your work. We'll get details on your information and contact information up when we do the add-ons on this too. Well, I would like to have you back on. I know you wanted to talk about EMFs. I'd like to have you back on if we could.
Yeah, anytime.
And record another episode. Let's get one more plug for your website.
Awesome. So again, it's iamregen.com.
There you'll find a bunch of information on stem cells and what Dr. Brady Wirick does. And how you can get in touch with him. Well, thank you, Brady. Dr. Brady Wirick in Idaho Falls. It is a pleasure having you on here.
Absolute pleasure, my friend.
All right. Bye-bye.